A very warm welcome to you. My name is Antony Bell. I'm the CEO and founder of Leader Development Incorporated, which is a company that does leadership development. We actually operate mostly in the business environment. I'm the author of Great Leadership, What It Means and What It Takes in the current world. And I'm co-author of a book called Rescuing Healthcare, which is why you're watching this, with Denis Cortese.
Yes, warm welcome to you also. I'm Denis Cortese. I'm a physician, practiced medicine for 40 years or so, and spent a fair bit of my career working at Mayo Clinic, and been interested in how to improve healthcare and improve the care for patients and reduce the costs in the country. It's been a major interest for us at Mayo Clinic and for me throughout my career. Because of the implications of what we were trying to accomplish, I thought that leadership played a big role, and it was that reason that I approached Tony to see if he could help learn about healthcare and contribute some of his thoughts to improving healthcare delivery in the United States.
So Denny, why did you approach me? Why did you come to me?
That's a very good question. Really, it boils down to the fact that about 2002, when I became the CEO of Mayo Clinic in Rochester, Minnesota, began to look at what was required to change the practice. That's really what we need. We need to improve the practice of healthcare, and began to realize as a leader, I needed some skills. How do you actually do this? And I began to look at the various books, and I read your book, and I found that the construct of leadership that you had portrayed, even though it wasn't related to healthcare per se, it was just the construct of the elements of leadership and what need to be thought about to be extremely helpful for me. And I began to use some of those elements in presenting it to some of our senior staff back at that time.
And I have to say that when you approached me, I was absolutely delighted because, as you know, Denis is a very well-known voice in healthcare and healthcare delivery. And so for me, that was a huge opportunity. I was really, when you think about healthcare, the impact that it has and how important it is, it's a great field to really think about what it does great leadership look like. And it's a field that has these enormous problems and challenges to it. In fact, why don't you tell us a little bit about how you see these problems and, in fact, how we sort of address them in the book?
Well, yes, that's very similar to what our original discussions were, because a lot of people think healthcare runs relatively smoothly. A lot of people think it doesn't run very well at all, but about 80% of the people don't ever encounter the healthcare system, so we can actually get pretty blasé about it. And the fundamental problem we have in the United States requires us to think of what the patients really want, is what I described to you before. What do people really want out of healthcare? And what we were doing back in the 1990s and into the 2000s, going around visiting with thousands of people, we engaged them in a number of activities, and I would ask 3 questions to them, and we're going to ask them again so people can think about it. 1, who would like to be admitted to a hospital tomorrow, even if it's the best hospital in the world? And so far, nobody's ever said they want to actually go to a hospital.
Yeah, that's kind of a no-brainer.
So right there, I began to say, well, healthcare in the United States is oriented around hospitals. But if nobody wants to go to them, we need to think differently about how we deal with that. Second question I said would ask is, who would actually like to be sick tomorrow and have to see a doctor? And nobody really wants that to happen.
No one raises their hand on that one.
Nobody raises their hand either. So that means we have to really rethink how do we keep people healthier and care for them. And then the third question was, who really would like to be a patient? Somebody who long suffers or long endures. That's the definition of a patient. And not a lot of people want to do that either.
No.
So if you look at that, and then you look at our current delivery system, which is oriented around the concept that when patients are sick, we make money as providers. You can't get those two matched together.
Yeah.
You know, the goals that we'd like to go to is totally different than our current delivery model that exists. In fact, it's a 180-degree change.
Yeah.
It's a complete change. That's where leadership comes in.
Yeah.
The question I came to you is, what can leadership do to help us do that?
Before we go there, so basically we've got a system that really thrives on a sick population. In other words, the more sick
It's
it
a
is,
sick delivery. It's a sick system.
it's a sick
in two
and
more ways than one.
more,
Perhaps.
yeah, but it really thrives. Hospitals, by and large, they do better when there are more people filling their beds and coming into.
Not by and large. That's how they do better.
That's how they do
what
better.
They do, right.
So that's got it backwards, right? So that's one
That's
of
got
the,
it backwards if you agree that that's a new vision that we want to
yeah,
accomplish.
that's right.
That's
yeah.
the point.
Yeah. Okay. So and then we list in the book, one of the early chapters at least 6 different things that are wrong with the healthcare system. So we've identified in the book what those problems are. You know, the lack of vision, the lack of purpose, or the unclear vision, unclear purpose, and how the different domains of healthcare are actually in competition with each other.
That's correct.
So we need something that kind of pulls them together, a vision and a purpose that does it.
And that's exactly right. So if you look at the vision saying, well, if the vision is to try to attain the goals of those questions, that is, well, use myself as an example. I got 5 chronic medical problems.
Mm-hmm.
I prefer to never have to go to a hospital.
Mm-hmm.
I was in one this summer, but I prefer not to have to go.
Right.
That becomes a goal.
Yeah.
I'd prefer not to even see my doctor if I can avoid it.
Yeah.
Television, telephone, or good care, so
Yeah.
I'm taken care of very well.
Mm-hmm.
And I'd really like to not be a patient where I long suffer and long endure. I have to live with my conditions, but I'd like to stay active,
Yeah.
be able to live with them and be as active as possible. So when you look at that, and then you look at our current delivery system and you see the problems there, which are basically that we are getting very unequal quality of care throughout the country.
Yeah, there's a huge variation.
Huge variation. We've mentioned that in our
Yeah.
book and why that is that variation. But in addition, the costs of care, particularly for an individual patient over time, is very high on average. However, we have regions in the country where we have very high quality and low costs that compete with European countries.
Yeah.
On other regions, we have third world delivery
Yeah.
experiences.
High cost.
Very high cost for
delivery.
very poor quality.
Yeah.
So somehow, and on average, the country is not performing where it ought to be at all. So if somehow we can change the thinking, so we develop a shared vision to get these goals accomplished, try to move all the providers to performing like our best providers, that takes leadership. That takes
Exactly.
leadership. And how do you make those changes throughout the whole organization? So we're getting really excellent quality at reasonable costs, and that's what we call high value care. We describe that in the book. And high value is basically, some people will say it's a judgment for themselves, but all of us make judgments about value. When we buy a cell phone, some of us need a smartphone, some of us don't need all the other apps we've got, but everything we add onto it, we're paying more, so we're making a value judgment. What do we need and how much do we want to pay? That has to exist, I think, in healthcare too, so we're getting really good outcomes at low costs overall, as low cost as we can manage. Doesn't mean it's cheap, because cheap doesn't mean it's going to be high quality.
So especially over the long term. Yeah.
And high cost doesn't mean you're going to get high quality either in our current system.
Yeah. Okay.
So that's when I came to you and I said, okay, here's our problem. Here's where we are. Here's where we think we'd like to go. We, meaning the groups that I work with on the medical side, have been trying to create a shared vision for the new future. And that shared vision is actually coming closer every day when we look at elements that people discuss in Washington about we need high value. We need to pay for high value. We need to create a system that is connected so we can be a learning organization. So we're learning as we move along. We need to think about the idea of individualized or personalized medicine, precision medicine. The Biden moonshot is an example of that. How are we going to incorporate that in our care? We need to be thinking about using scientific thinking, not just for basic research, but scientific approach to deliberately improve the way we provide care. We call that the science of healthcare delivery in the book. And then we have to think about how we create integrated and coordinated care for patients, because the whole purpose of the delivery system now should be focused on the patients to get high value, good quality, lower costs. We also have to think about how we change how we pay for healthcare. If you pay for healthcare, fee for service, where I make money keeping people sick, that doesn't work.
And it's a focus on process, not outcomes.
Exactly. So if we focus on outcomes and we find models of payment that actually I can stay in business by keeping people healthy out of the hospital, out of my offices.
That's a
whole different model.
That's
It's
a fundamental
change.
shift. Yeah.
So that's when I came to you, and I'm going to ask you, okay, given all that, what can leadership skills do to contribute to the goals we want to get to?
Well, and as you know, and as you practiced at Mayo, leadership is critical. I mean, it is the absolutely critical variable in not just in healthcare, but everywhere.
Right.
And what actually intrigued me about when you came and approached me, what intrigued me is when you think about how we can really make a contribution to our society, we think of, we come down to leadership, and leadership is critical. But there's certain key areas that, to me, are fundamental. So I've been involved in business. So our company coaches CEOs and senior executives. We've done hundreds of them over the years, and we help them lead and change their organization. So my focus has been in a business environment. But I've always been intrigued by, what does great political leadership look like? What does great leadership look like in education? And so when you came to me and we started talking about healthcare, it just struck me, healthcare blends them all. You've got business in there, you've got huge businesses in there, you've got political leadership, not just on the policy side, but also on the regulatory side. You've got the legal profession, hugely influential. Then you obviously got delivery, which is huge. And so in a way,
insurance companies?
And insurance companies?
Certainly the different insurance companies, the different insurance models, some of which are private, many of which are public, like Medicare, Medicaid, S-CHIP program, the TRICARE, the Federal Employees Health Care Plan. There are all kinds of government models too. But you're right, there is quite a large number of stakeholders involved in this delivery system that we're talking about.
And they all need to exercise leadership in a certain way to make healthcare as a whole work really well.
So you're saying they actually have to agree to the shared vision?
They absolutely have to.
They have to be part of the direction that we're trying to go.
That's exactly right. And what we want to do in the book is we want to change people's mindsets. We want to reframe the discussion.
Now that must be ezy to do.
Yeah, piece of cake. Yeah.
Okay,
so why hasn't anyone done it yet?
Yeah.
So, well, I think part of the reason is that there have been a lot of good solutions that have been offered about healthcare, and they do tend to focus on pieces of healthcare. So whether it's coverage and insurance, or whether it's payment systems, it's tend to be focused on specific things. Very few people have spoken about leadership in healthcare. And to us, that's the critical piece. If you can address if you can address the leadership, you can address every aspect of it.
Let me ask you that then. You're talking then about leadership in all of the stakeholder areas, just not like one big boss or something like that. So if the leadership though doesn't have that shared goals and vision, and they tweak one part of this complex system, like you say we've been doing in the past, we'll get a whole bunch of potential unintended consequences.
Exactly, and that's the whole thing about systems thinking. In fact, the whole of the healthcare sector is a fascinating case study for systems thinking, because a decision in one area may make perfect sense in that area, but it has devastating effects on another area.
Right.
So to be able to address that does require great leadership. And so that's what we address in the book. It's really the fundamental element that really will bring about the change in healthcare.
And that's why in the book you sort of insisted that we look at leadership implications for people who are in all these different sectors, not just leadership for physicians.
So
for instance.
exactly. So what does great leadership look like for a physician? What does it look like for a legislator, whether it's in Congress or whether it's in a state legislature? What does it look like for a regulator? What does it actually look like for a patient? Because patients need to know what great delivery looks like so that they can then expect that from the people who are delivering it. So it actually speaks to the patient as well. The patient needs to know what to expect, and that means every single one of us, because every single one of us is a present or a future patient. You know, it's inevitable.
Yeah, everybody's pre-op, as we say in the
Exactly.
healthcare side.
Yeah.
So let's extend that then to the insurance side of the house. Then the insurance side is basically our payers.
Yeah.
There are certain times they pre-approve and things like this for certain procedures, but fundamentally their job is to try to pay for the health care and try to get it as smooth and organized as possible. They have to buy into the concept of changing the way they're paying.
Yeah, they do.
Because the fee-for-service model that we have it pays only when people are sick, basically. The fact that many models, particularly in government, use price controls. Price controls basically say we're not going to pay any more for this amount, but we as physicians control how many times we use that. So the amount that we spend,
you control the user rate.
We use the user rate. So the amount we spend for care is a function of the price at times, how many times we use it. So if part of the system is only controlling the price, and we drive up the use rates, the spending still goes up.
Yeah.
And that's one of the unintended consequences
right.
you're talking about. And fixing all of that requires a huge change on the payment side also.
Yeah, it really does. It does. So what we need to do is help people understand what great leadership looks like, whatever their role as a stakeholder in healthcare. And so that brings us, what does that look like? So a lot of the book we address to really the essence of the book is, what does that mean? What does that look like? What does that leadership look like?
That's the construct
That's
we
the
were
construct.
talking to. And that's how I came to you to begin with, looking at the construct.
Yeah.
Okay.
So, so kind of briefly, when we think about great leadership, we think about, really, it comes down to two fundamental things. And this is what we call the framework for great leadership. So to be a great leader, and this is universal, it needs two things. You need to be competent as a leader. That doesn't mean technical competence, whether it's an accountant or an IT guy or a physician. It's competence in leadership. And one of the confusing things for us is that leadership has become much more complicated over the last 30, 40 years. It's just a very complex environment that we actually operate in. And so what we need to do is try and make sense of that complexity. And it's complex, whatever your role as a leader, whether you're a regulator or a legislator or a physician, or whether you're an insurance company, whatever it is, it's a very complex environment. And in fact, when I was looking, and I think I told you this, when I was looking for a publisher, my agent and I were looking for a publisher for the book Great Leadership, we went to Amazon and we looked up the number of titles there were that had the word leader or leadership in the title. And there were 64,000 of them. Titles, not books, but titles. And when I saw that, I thought, how on earth are we going to find a publisher? But then I thought, there's a huge demand for this. If there are that many books on it, people must be really looking for it. And then I thought, there's a lot of confusion, because all those voices are trying to say, this is what great leadership is. And how do you know which voice to listen to? And that's what, when I was back in the 90s, and this is kind of the genesis of that framework, I was subcontracting for a training organization, and we were doing a lot of stuff. I was doing a lot of stuff in companies around change leadership and strategic planning and so on. And what struck me was that leaders really are confused. They just don't know what they're looking for. Even the ones that seem to be doing well were sort of second guessing themselves. And so in the 90s, as a result of that, I set out on a quest to figure out what is it that's going to help them. And I concluded they needed something that helps them know what they need for the role that they have. Do I need emotional intelligence? Do I need systems thinking? Do I need situational leadership? Do I need this or do I need that? They need to know what they need. And so that was the construct, the framework that developed out of that. So it's based on two things, character and competence. And those are very, very fundamental to all leadership. So if we're on a football team, And we have a coach that we think is absolutely first-class ethical guy. We trust our kids with him. But he's hopeless as a coach.
Yeah.
As a
High character.
high character, but low competence. He gives us a call to go out and take out onto the field. What's our level of confidence? What's our level of trust in him as a leader if we can't really trust the calls that he's making? So you need the character, but you also need the competence. So those are the two pieces that are absolutely fundamental. It's like the two wings of an airplane. And you can't fly one without the other. You can't have one wing without the other.
Now, is that true at all levels of leadership? Because in our book we talk about the CEO or the head coach or the president, but then there are many other people who are, the colonels, for instance, who are getting the work done, the leaders of departments, committee groups, units, those sorts of things. Those are a little heavier oriented into operational stuff.
So, and that's a great point. And so the point of the framework is so that we know what do you need at a certain level? Your CEO, what do you need, what does competence look like for a CEO?
At a CEO level or president level.
Or a president level. What does it look like if you're leading a team on the front line? And it's going to look really different. But there are three components that will be present in all of those, but to different degrees, to a different mix. So the analogy I make is to a ship. I think we use it in the book. If you think of a ship, the captain on the bridge is responsible for the ship as a whole. And so the captain has to make sure that it gets to the right port of destination. He's looking outside the ship, and there's a storm brewing over. It's traveling. The ship's going west. There's a storm northwest. So let's change direction to make sure we avoid it. A lot of places in the world, on one side of an island, there's a current is going one way and it's going the other. If you're smart, you'll go in the side with the current going the same direction. All those are decisions that are made at the top of the organization, the CEO and the CEO's team, looking outside for the direction. We call that organizational leadership. It's really making sure that the whole ship is running.
We know where we're going.
Know where we're going, exactly. And so you don't hit any other icebergs or boats or ships, and you don't run aground. You know where you're going. Now, it doesn't matter how good the captain is on the ship. If that ship is dead in the water because the engines aren't running or because the cooks don't know how to cook and they're poisoning the crew,
and the people running the engine don't agree with where you want to go.
Well, that's right. Yeah, they have to buy. They have to know.
Buy into where you're trying to get the boat.
Exactly. Yeah, So you leave New York and you get together and you say, okay, and this would be unthinkable on a ship, but it happens in so many organizations. You get together and you say, okay, do we go to? Are we going to Liverpool? Are we going to Lisbon? Buenos Aires? That doesn't happen on a ship, but it happens in a lot of different organizations, and so people don't agree. Some people say, I want Liverpool. Other people say, no, Buenos Aires, no, Lisbon. So running the ship is what we call operational leadership. You've got to have someone on the bridge who can
sets the destination. That may not be a democracy situation.
It may not be.
There.
No,
yeah,
it may
right.
not be.
Okay.
Now, you assume that they've got on the ship knowing where it's going.
Yeah. Right.
So they've at least bought into.
But the captain also has to convince folks and make sure that they are with the shared vision.
Exactly.
Then they have to operate to get us there.
Yeah, exactly. Okay. And so you're right. It's one thing having a vision. It's another having a shared vision, right. Which is really what the captain on the bridge has to make sure that it really is a shared vision. So the ship has to run well. You've got to have the engineers in the engine room running the engine, making sure the engines are running. You've got to have the cooks cooking good food so that people don't get food poisoning and so on. And then, so we call that operational leadership. It's leading the operations. And then you have the people on the ship. And whatever their roles are, you've got to have the people in the right places. You don't want cooks running the engines. You don't want the engineers cooking the meals. You've got to have the people in the right places, and you've got to develop them, and you've got to give them sort of that kind of people leadership, which is what we call it. So you've got organizational leadership, operational leadership, and people leadership. Now, to your point, at any level in the organization, that mix is going to exist, but it's going to be different. It's going to be very different for a CEO than it is for a frontline leader. So you're absolutely right. It really is, it applies to every level, but it applies differently. And we want people to know, whatever level you're at, what does it look like? It'll help a physician. You know, a physician who's leading a unit it'll help him or her understand, what does that leadership look like?
Mm-hmm. Well, I found that construct, people would have to read the book to get all the details of all the little elements that are there, because Tony does go into great detail about how to think about this, how to organize, and how to make this work, which I found to be extremely useful. And the leader at the top basically sort of sets the direction, as you indicated, and the rest of the people need to understand where we're going, understand why, and accept that, and you get into the details about the impact on culture, on how we change the organization, how we find the right people to help make this work, and how we change it at a pace that is tolerable. I found it to be extremely useful in my organization to accomplish a goal, which we had 52,000 employees when I was working there, and to get everyone to understand where we were going and why, but also try to work it in a way that each person could see where they fit in to their ability to contribute. And many people fit in really at that operational level, taking care of patients, keeping the place clean, interacting in a kind way with compassion for the patients. That was their job, and they did a great job. And they weren't there to come up and say, well, we really disagree, we ought to be doing something different. Leadership's role is to establish that and have the right people. So I would just encourage people who are in a situation like this, that see this problem, and want to move in a particular direction, whatever direction that is. In our book, we actually set a series of vision for healthcare. Others may have different visions or different strategies, more likely, to accomplish the fact that we need better outcomes and lower costs. That's a given. We have to deal with that in the country. So people come to the book, they'll have a chance to learn what you have taught me and others about a construct and how leadership can actually contribute to accomplishing these goals.
And I think what you did at Mayo was just phenomenal, because what you understood how it applied to you, but you also understood how it applied to people who are at a much more operational level.
And that was a learning from your book about how to put, well, of course I was in those positions in the past, but to really recognize that the leader can't win the game. They can just set the goals like the coach or the manager, but other people have to deliver the goods. So I just want to say to the audience that hope they'll read the book. I think Tony has done an excellent job in creating a structure for people to think about. And for that, I'd really like to thank you, because you've helped me a lot.
Well, thank you. And it's just such a pleasure working with you, Denny, on this.
Thank you.
And we really want to thank you for watching this and coming to the website. And also, one other thing that I wanted to mention is we have we give an illustration in the preface about using D-Day. And there is a free download on the preface on the website. So in many ways, that illustration kind of encapsulates a lot of the things that we've been talking about. So that would be, I'd encourage you to go and look at that. Get the book, and most of all, join the conversation. We'd love to hear from you. We'd love to have you be part of reframing and reshaping this conversation so that all together we can rescue healthcare.
Thank you.
Thank you very much.